Joining us now from the University of Washington School of Public Health is gun violence expert Dr. Fred Rivara. So, Doctor, first of all, thank you for being with us. We have seen a rash of gun violence, with many of the victims, like we saw this past weekend, being children. So what is going on? What is behind this?
Well, this has been a tremendous problem during the pandemic, and we know that homicide rates in the United States on the whole have gone up significantly during this last year, while many of the previous years they have gone down. So this is the first year we're seeing this protracted uptick in homicides. And I think it's due to a wide variety of issues. First of all, we know that purchase of firearms has gone up tremendously during the pandemic, and the primary reasons why people buy firearms is for self-protection. They're worried about breakdown order, worried about intruders, and so they buy a firearm for self-protection. But we know that having a firearm in the home that's unsecured actually increases the risk of death to people in the home, either from homicide or suicide. We also know that firearm injuries and deaths go up in times of stress, in times where people have lost their jobs, in times of economic recession. All of those things have happened during the pandemic. People are really stressed out there. Everyone is stressed, whether it be people that have jobs, people that have lost jobs, people that are homeless, people that have houses. Everyone is stressed. I think we're seeing that in this outbreak of firearm violence.
Doctor, from a community standpoint, how do we stop this? Does it come down to firearm education?
There's no simple fix for this. We realize that. You know, we live in a country that has a Second Amendment. We have to respect that right of people to own firearms. I think that for people that choose to have a firearm in the home, to realize that does pose dangers to people in the home, and to make sure that it's securely locked up and where people that shouldn't get access to it can't get access to it. Secondly, if we know that somebody is at a very stressful time in their lives, when they're undergoing severe depression or anxiety or other mental health problems or substance abuse problems, we do have tools in this state to try to reduce the risk that they'll use a firearm to harm themselves or other. There's something called the Extreme Risk Protection Order, where a family member or household member or the police can petition a judge to remove that firearm from the individual while they're undergoing that stressful period. At our website, at the Injury Center here at Harborview, we also have a list of all the places around the state, law enforcement agencies, gun shops, gun ranges, where people can bring their firearm to be temporarily stored. We also are one of the few states in the country that has something called do not sell law, where an individual at the time that they're not undergoing stress but have a previous history of that can go to the county clerk and register as don't sell me a firearm. And that is something that is completely voluntary and reversible. So that can prevent somebody from buying a firearm when they're under terrible stress.
So as we come out of the pandemic, where do you think this is headed? And last question, Doctor, what is your advice for all of us to do something if we feel like someone in our family may be in crisis? I mean, we all have the power to do something and inject ourselves if we think that someone may hurt themselves or others.
Well, I think the first thing would be is if they have a firearm to make sure that they are safe and that other people in the household are safe. And that's where I would say use the Extreme Risk Protection Order, or take the firearm and have it be brought to some place, a police station or a shooting range that will hold it for you until it is until the crisis has passed. Having a firearm in a home where somebody is very stressed and depressed is a terrible mixture that's going to end up in tragedy many times.
All right, well, we appreciate your time and insight. University of Washington School of Public Health gun violence expert Dr. Fred Rivara, thank you for your time and expertise.
Thanks very much for doing this.